Hey YouTube, Sean Ferguson here with Life Skills Therapy. I'm a speech-language pathologist, and I'm here today to talk to you about use of the skilled cueing hierarchy, or what it is speech pathologists actually do in therapy sessions. I'm going to speak to pediatrics because I work primarily with children in pediatrics. So once I've identified the kiddo's concern, if it's that they're not combining words to make sentences, if they're not using their sounds correctly at the word or phrase or sentence level, what we try to do is give as little help as possible for the maximum amount of results. So for example, if they need help producing an S sound, they're producing it fronted or lisped. Like instead of saying sun, they're saying thun. Then I may tell them, hide your tongue behind your teeth. And then I'll smile and say, smile, put your tongue behind your teeth. Okay, tongue up. Some kids make it a tongue down S, so that's okay too. They can make a tongue down S. But either way, and so I'll remind them, I'll show them, we'll point, we'll practice. We'll make silly snake sounds, all that kind of stuff. There's a lot of ways to work on this. But the whole idea is then over a period of time, I'm reducing the amount of cueing I'm giving. So I may just look at them and go, and they may know immediately, oh, I need to hide my tongue behind my teeth. That's not going to happen the first session typically, but over a course of several sessions, the kid's going to remember. And of course, the whole goal is the kid will generalize this and they will become independent with their use of the strategy to improve their speech or language skill. It happens over time. It happens with the help of parents with caregiver training, which is a huge, huge component of it, should not be overlooked, is just teaching the parents, hey, this is what we're working on. So we think of the speech and language components of the brain simply as a muscle that needs to be trained. And what we do is train that muscle through use of the skilled cueing hierarchy and other therapy techniques in speech therapy. For example, you wouldn't show up to the gym on your first day and expect to lift a 300-pound weight. What you've got to do first, of course, is learn to lift smaller weights. And essentially what use of the skilled cueing hierarchy is through giving the child help in speech therapy, it's allowing them to move toward meeting that goal with assistance, and then reducing the assistance over time, specifically, gradually, and therapeutically as appropriate in order to give them greater independence, which ultimately is the goal. There's nothing greater than seeing families happier, the child's communicating better, and lives are just better for everyone as a result of work in speech therapy. And to see this work over time after a period of sessions is amazing. We see results in speech therapy because it works. And I love it. That's what gives me just the joy of my life is helping kids learn to communicate and improve those skills. If you have any questions, please feel free to send me an email. You can check out our website below at lifeskillstherapy.com. Comment, like, and subscribe below, and I look forward to talking to you guys again soon. Thanks.